We do have a little bit of breaking news here. President-elect Trump has just announced on his Truth Social account that he is picking Robert F. Kennedy Jr. to be the next Secretary of Health and Human Services. This comes after RFK suspended his third-party bid for president and endorsed Trump in the final months of the campaign. Of course, RFK is an outspoken vaccine conspiracy theorist and has often repeated claims about vaccines being linked.
Hey, everyone. Welcome back to Dynamo Health. Let's talk about something that's been lighting up the news lately. Robert F. Kennedy Jr. has been nominated by the president-elect to be Secretary of Health and Human Services. It's been about a week and the reactions have been explosive. Even in the comments section on my videos on this very channel, some people are cheering this as a revolution in healthcare, while others are panicking. Yes, panicking. Today, we're breaking down why RFK Jr. has so many people frankly scared, what his nomination really means, and why meaningful change in the US healthcare system is so hard to achieve. Let's dive in. Here's the deal. The US healthcare system is a mess. We're spending trillions of dollars, yet millions of Americans remain uninsured or underinsured. Healthcare costs are skyrocketing, and public trust in the system is plummeting. RFK Jr. is walking into a lion's den of entrenched interests and broken systems. He's not just here to play politics. He's here to shake the table, and that has some very powerful people sweating. Let's start with the elephant in the room. Why is RFK Jr. so controversial? And who exactly is scared of him taking the reins at HHS? Well, first up, Big Pharma. Pharmaceutical companies are probably shaking in their boots right now. Why? Because RFK Jr. has made a career out of criticizing their influence over public health policy. He's called for greater transparency in drug pricing and stronger accountability for safety and efficacy. That's a direct threat to an industry that rakes in billions of dollars annually. Think about it. If RFK Jr. gets his way, the days of $1,000 pills and unchecked influence over health policies might be numbered. Next, let's talk about government bureaucrats and lobbyists. The Department of Health and Human Services is a massive machine, and many people within that system have a vested interest in maintaining the status quo. RFK Jr. represents a disruption to business as usual. He's not a career politician. He's an outsider, willing to ask uncomfortable questions. That makes him a wild card, and wild cards scare people. Here's the harsh truth. Proposing real change in healthcare is like trying to steer a cruise ship using a canoe paddle. The system is enormous, deeply entrenched, and built on a web of competing interests. Let me break it down. First, there are financial interests which dominate. Pharmaceutical companies, insurance giants, and hospital networks have immense financial stakes in keeping things as they are. These industries pour millions into lobbying efforts every single year. In 2023 alone, the pharmaceutical industry spent over $375 million lobbying Congress. That's more than any other industry in the US. And believe me, the election cycle guaranteed to be no exception. Next, there's political polarization. Healthcare reform is a political minefield. Any attempt to shake things up quickly gets caught in a left versus right tug of war. Even ideas with broad public support, like lowering drug prices, often get derailed by partisan bickering. RFK Jr. will need to navigate this political circus while staying true to his mission. That's no easy feat. Then there's public skepticism. Let's not forget the people. Americans are deeply divided on healthcare issues, and trust in government institutions is at an all-time low. Even if RFK Jr. has the best intentions, winning over the public won't be easy. Don't believe me? Look no further than the comment section on this very video and the videos I've done recently covering this whole health issue and the appointment of RFK Jr. Now, let's flip the script. What if RFK Jr. pulls this thing off? What if he actually gets the chance to enact meaningful reforms? Here's what could happen. First, prescription drug reform. RFK Jr. could push policies to cap drug prices, enforce transparency in pricing, and hold pharmaceutical companies accountable for unethical practices. This could make life-saving medications affordable for millions of Americans. Next, revamping public health. Imagine a public health system that prioritizes prevention over profit. RFK Jr. could focus on reducing chronic diseases by tackling root causes like poor nutrition, environmental toxins, and lifestyle factors. And of course, restoring public trust. By prioritizing transparency and accountability, RFK Jr. has the chance to rebuild trust in our healthcare system, something we desperately need after years of scandals and mismanagement. But let's be real, this will not be smooth sailing. RFK Jr. faces fierce opposition from both sides of the aisle, massive resistance from within the healthcare bureaucracy, and the looming threat of being undermined by powerful interests. It's a fight that will test not only his policies, but also his resilience and character. I think that can be said about this entire incoming administration, by the way. The question is, can RFK Jr. succeed where so many others have failed? So, what's your take? Is RFK Jr. the disruptive force we need to fix America's broken healthcare system? Or is the deck stacked too high against him? Let's get the conversation going in the comments below. And if you found this breakdown insightful, hit that like button, share this video, and subscribe for more content on healthcare, wellness, and the future of medicine. It's been Dr. Dynamo, reminding you to stay informed, stay engaged, and as always, stay dynamic. Peace.